Hi, I'm Rebecca from AUT, a secondary paramedic student. What's your name?
Sarah Smith.
Okay, and can I just confirm your date of birth?
11/7/65.
I'm just going to do an abdominal assessment on you today. So I'm just going to be having a little feel of your tummy. Is that all right?
Yes, that's fine.
Okay. So I've been looking around the environment, just having a look for any feeding tubes, stoma bags or medications which could indicate the patient has an abdominal problem. I'd also look at the positioning of the patient, so the patient is lying supine. They've got a GCS of 15 and there's no signs of any cachexia or obesity and they look to be in a good nutritional state. Do you have any pain at the moment?
No.
Okay. So whilst getting a patient history, I'd just be having a look at the arms, noticing if there's any track marks which could indicate IV drug use, meaning the patient could be suffering from hepatitis or HIV. I'd also look at hair loss, which would show malnourishment or iron deficiency anemia. Jaundice of the eyes would show possible cirrhosis or hepatitis, and any mouth ulcers would indicate Crohn's or celiac disease. So I'd be observing the abdomen and just asking the patient just if they can pull their t-shirt up a little bit. Okay, thank you. I'd be observing the abdomen for any scars, masses, pulsations and distensions. Can't see any signs of that. Cullen's sign is oedema and bruising around the umbilical area, which would indicate internal bleeding. Gray-Turner's sign is bruising off the flanks, which would show the patient could be having retroperitoneal hemorrhage. Caput-medusa is distended para-umbilical veins, which occur during portal hypertension, and I'd also be looking for any stomas.
Further questioning that is important is if the patient has dysuria, frequent urination with lower abdominal discomfort, as this could show a lower urinary tract infection, also known as cystitis. This would generally be a status 4 patient and can be taken to their GP unless any red flags are prevalent. Cystitis is a pathology which shows the importance of assessing the level of consciousness in patients, as it is a common cause of confusion in the elderly.
I need to palpate each region of the abdomen. Is that okay?
Yes.
Just looking for guarding tenderness and rebound tenderness. And whilst I'm doing this, I would be observing the patient's face to see if they are in any pain or discomfort. And Sarah, I'll just get you to tell me if there's any pain at any time.
If there is guarding or rebound tenderness in the right lower quadrant, this could be indicative of appendicitis. This, accompanied with signs of infection, repeated vomiting, distension, and an increased heart rate, could indicate peritonitis. This is a medical emergency and would increase the status of the stable patient to a status 2.
If I feel any masses, I will document the size, location, and consistency of them. I would then go on to do a deeper palpation as well. To palpate the liver, I'll just ask my patient to take a few deep breaths in and out. And again. Okay. And the same with the gallbladder, and this would be testing for Murphy's sign, which, if positive, would indicate the patient could be suffering from cholecystitis. The gallbladder is not normally palpable unless inflamed. The spleen is also not palpable unless inflamed, and this would indicate that it is 3 times larger than its normal size. To palpate the kidneys, I put either hand on the anterior posterior wall. And we'll also palpate the abdominal aorta. And just breathe in and out normally. And look for any pulsating. If I feel any pulsating and there is upward movements of my fingers, this would indicate an abdominal aortic aneurysm. Would also palpate the bladder. When the bladder is empty, it is not palpable, and when it is full, it is, but this could indicate urinary retention. I then need to percuss the abdomen, percuss for the size of the liver. Just working my way up and then back down to see the rough size of it. I'll do the same for the spleen. Moving to the left side of the abdomen. And on the bladder as well. I then need to auscultate the bowel sounds using my stethoscope. So I'm just going to pop this on your tummy and have a little listen. Is that alright?
Yeah.
So gurgling bowel sounds are normal. Any abnormal sounds could indicate that there is a bowel obstruction, and bowel sounds are deemed to be absent if there are none heard within 2 minutes. I can also auscultate for bruits of the aorta. This would indicate an abdominal aortic aneurysm, and also I can auscultate for renal bruits, just lateral to the umbilicus. Thank you, Sarah. The 4 main quadrants of the abdomen is the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. And it's further separated into regions: the right hypochondriac region, epigastric, left hypochondriac, right lumbar, the umbilical region, the left lumbar region, the right iliac, the hypogastric region, and the left iliac region. Flags of abdominal pain are severe pain, abnormal vital signs if the pain radiates to the back, if there's loin or flank pain, breath temperature over 38, suffering from rigors, if they're a female of childbearing age, and there's a possibility they could be pregnant, if they are pregnant, if there's tenderness on palpation, if the pain is worsened by movement, if the pain is similar to indigestion, if it's epigastric pain, or if there's repeated vomiting.
If a patient had abdominal pain, we would assess this by asking them if it started gradually, suddenly, or did it get worse over time? If anything makes the pain worse or better, how could they describe the pain to us? So is it sharp, dull, or maybe cramping? If the pain radiates anywhere, get them to give a rating on a pain scale of 0 to 10, and also ask the time it started, how long did it last for, or how long has it been there for.